The Rheos carotid baroreflex stimulator device is an implanted device for the treatment of high blood pressure. And what we found in the preliminary studies is on people who have high blood pressure, defined as resistant blood pressure, a blood pressure of greater than 160 on 3 or more medications, the average drop in blood pressure is between 24 and 30 points. This is the equivalent of 3 or 4 medications for many of these people. And most of the patients who were enrolled in the trial were already on 6 medications. One of the requirements of the trial is that one of the 3 medications that they're on is a diuretic medication, and but we found that the vast majority of the patients referred at this point have been on an average of 6.3 medications. This is a carotid baroreflex stimulator device. It's implanted right under the clavicle in the same way that a pacemaker or an implanted defibrillator might be implanted. 2 wires come out of this. They're tunneled up under the surface of the skin toward the neck, and electrodes are wrapped around each carotid sinus. The device provides a continuous stimulation of between 4 and 6 volts, mimicking a spike in blood pressure to the brain. And then the sympathetic nervous system is activated to cause a drop in blood pressure via peripheral vasodilatation, decrease in renal sympathetic tone, and in the long term, a general loss of sodium. So these 3 things, when taken together, along with a little bit of a drop in heart rate, cause the blood pressure to come down by a full 24 to 30 points. What we found in the subset of the patients who were referred for hypertension treatment, in this group of patients we did echocardiograms and found that there was some degree of left ventricular remodeling with this device being activated. The heart reshaped slightly, the degree of left ventricular hypertrophy decreased, suggesting not only does this lower blood pressure, but it lowers blood pressure in a way that is beneficial to the overall heart structure and function. This is a very exciting device, and we have another trial on the way looking at patients with heart failure with preserved systolic function, previously known as diastolic heart failure. These patients are usually very hypertensive, and it's usually very difficult to get their blood pressure under control. We're hoping and hypothesizing that this device will help them improve their diastolic filling and improve their overall left ventricular geometry, so that it may be an important tool in the treatment of diastolic failure, perhaps one of the most difficult to treat kinds of heart failure that we have today. We implanted the first device in a U.S. patient here in April of 2005. That patient had blood pressures that were well over 240, 250 at times, and she was suffering from severe heart failure, really could not do any of her activities of daily living without significant difficulty. The implantation of the device in this patient dropped her blood pressure by 60 and even 80 points at times, and she really has been able to resume her previous lifestyle, now with blood pressures that are in the 160 to 180 range, which, although not ideal, not at her target of 130 to 140, is a far cry from 240 and 250. She was on 6 or 7 medications at the time that were just simply not doing the trick in bringing her blood pressure down. We've enrolled a number of other patients in the interim whose blood pressure elevation was far less severe. Again, the entrance criteria for the trial are blood pressures systolic greater than 160 on 3 medications, one of which is a diuretic. And we're finding that many patients right now would like to try the device at that point, rather than consider additional therapy with medications, running the risk of side effects of those medications.